Hi, this is Keith. This presentation goes along with Chapter 9, so if you haven't read that chapter yet, it's a good idea to read that first, then watch this presentation. This chapter is jam-packed, so I'm not able to present everything from the book. Please be sure to read the book to make sure you're getting the full picture of sexual expression. In this presentation, we'll look at a number of different topics related to sexual expression, including different aspects of the sexual response, research on sexual attractiveness, sexual scripts and autoeroticism, and sexual behaviors with others. So this chapter is a bit spicier than the other chapters, so it'll be a good opportunity for you to reflect on your own comfort and ideas about sexual expression. Okay, so to begin with, it's important to understand that sexuality is significantly influenced by a variety of sociocultural variables. In other words, who we spend time with influences our sexuality. These sociocultural variables can include gender, religion and spirituality, social class, education, age, relationship status, and race and ethnicity. Now, for many, gender is probably the most influential in shaping their sexual desires, behaviors, and partnerships. Recall in Chapter 5 that gender is the social and cultural characteristics associated with maleness and/or femaleness, and encompasses a wide variety of people who fit in between those. So, our concepts and beliefs around gender may heavily influence what our sexual desires are, how we behave, and who we partner with. And just as beliefs about gender vary across culture, so do sexual desires, behaviors, and partnerships. A wide variety of research has helped us understand different aspects of the human sexual response, and this includes sexual arousal and orgasm. Orgasm is the climax of sexual sensation that involves rhythmic contractions of the genital area and intense pleasurable sensations. So while this is probably the most memorable part of the human sexual response, there's a lot more that goes into it. There are a number of models of sexual response that have been proposed. A model is a hypothetical description used to study or explain something. In this case, that something is sexual response. So that we're just on the same page, the sexual response cycle is the sequence of changes and patterns in the body during sexual arousal. There are three models of sexual response are best known. So let's take a look at these best known models first. So we talked about Masters and Johnson's work in Chapter 2. Through their observations and studies, they propose a four-phase model of sexual response. The stages include the excitement phase, plateau, orgasm, and then finally the resolution stage. Now we'll talk about these in more depth in just a bit. Later, later than Masters and Johnson's work, Helen Singer Kaplan proposed a triphasic model of sexual response with three phases: desire, excitement, and orgasm. Kaplan's formulation acknowledged the role of desire, noting that some form of thought, fantasy, or erotic feelings happen to cause an individual to seek sexual gratification. An even more recent model is Basin's intimacy model of female sexual response, which put even more focus on the psychological and emotional aspects of sexual arousal, particularly for women in long-term relationships. And then Lulin's sexual response model proposed a six-stage cycle incorporating both biological and affective components. By affective, we mean emotional components. Lulin added a willingness stage at the beginning of the process where people make a conscious decision to have sex even if there might not be emotional desire, and also added the concept of pleasure to account for individual differences in sexual response. And of course, any model of sexual response will need to have some kind of biological component. We know that across all persons, there is a swelling of the genital tissues called vasocongestion and an increase in muscle tension called myotonia when nearing orgasm. In persons with male genitals, that results in an erection, and in persons with female genitals, that results in clitoral swelling. Now, a final model to better highlight the role of the brain in regulating human sexual response is the dual control model. In this model, the developers noted that a lot of work has been done on sexual excitement, but the role of sexual inhibition, in other words, inhibiting sexual arousal, hasn't really been fully elaborated. So there are clearly times when sexual inhibition is necessary. For example, sexual arousal should be inhibited in the presence of potential risks. Those risks could include things like unintended pregnancies. Sexual inhibition is also needed so that people don't engage in excessive sexual activity that negatively impacts other areas of their lives. So again, sexual inhibition might be there to help us not become sexually compulsive. Now, we'll talk more about this and other types of compulsive sexual behaviors later in this course. Sometimes when we think of arousal, we can confuse this with desire. Now, these can be two sides of the same coin, with desire representing the psychological component of sexual arousal. Through decades of research, it's clear that desire includes a complex interplay between thoughts and feelings, sensory organs, neural responses, and hormonal reactions. For example, how we feel about our own bodies and genitals has a big impact on our own desire and how desirable we believe we are to our partners. Rather than thinking if the relationship between desire and arousal, thinking about the relationship between desire and arousal in a sort of linear way, with arousal always following desire, it's clear that they have more of a circular sort of relationship where desire may follow or be preceded by arousal. So for some people, desire can be triggered by sexual activity. Now, what is clear is that the brain has a critical role in the sexual response cycle. Through the neural system, the brain receives stimulation from five senses: sight, smell, touch, hearing, and taste. And another critical component that we often sometimes overlook would be the imagination. Think of the romantic and sexual preoccupation we have with a new lover. We imagine what sex would be like, or what we'll do together, or what life will be like with them. Studies show that early in relationships, our bodies release endogenous opioids that block pain messages. So falling in love lowers our physical pain. A part of the brain where much of our emotion responses can be traced is the limbic system. Here may lie the basis of our emotions and feelings, including those that are related to sexual arousal. But input to inform sexual arousal can also come from other places than just through our brains. Think of erogenous zones, which are places on the skin that are highly sensitive to touch. These could include the genitals, breasts, mouth, neck, or other places. Erogenous zones differ from person to person and from culture to culture. Our libido is also influenced by a number of different hormones, the most significant of which are testosterone and oxytocin. Females produce testosterone in the adrenal glands and the ovaries, and women appear to be more sensitive to fluctuations in testosterone than men. Estrogen also impacts sexual functioning by helping to maintain the vaginal lining and assists with lubrication. Finally, oxytocin can increase nipple stimulation, and it is released in varying amounts during orgasm. Okay, let's talk specifically about the female sexual response. We'll talk more about the male sexual response later. Some signs of sexual excitement among persons with female genitals include sweating, indicated by the seeping of moisture through the vaginal walls. We also see the expansion of the vagina, known as tenting. The skin becomes darker, known as sex flush. A thickening of vaginal walls occurs in the plateau stage of the sexual response cycle, called the orgasmic platform. And finally, orgasm. This is the peak sensation of intense pleasure and can create an altered state of consciousness. Accompanying orgasm are involuntary, rhythmic uterine and anal contractions, myotonia, and a state of well-being and contentment. Okay, so returning to Masters and Johnson's stages of female sexual response, let's take a closer look at these states. Remember that Masters and Johnson had thousands of hours of observation and used devices to measure physical changes in the body to arrive at this model. So here you see the stages of their model. Changes that occur externally are shown on the right, and changes that occur internally are shown on the left. So in the excitement phase, the uterus is elevating, vaginal lubrication appears, the clitoris engorges with blood, the clitoral shaft and glands swell, and the glands retracts beneath the hood. The labia minora swell and deepen in color and enlarge. The labia majora also swell and they separate from the vaginal opening. And the Bartholin's glands may secrete a small amount of fluid. In the plateau phase, sexual tension levels off but is still high. Also, in this stage, the uterus elevates further, the upper part of the vagina expands, the vaginal wall forms an orgasmic platform, the color of the labia deepens, and the clitoris withdraws under the clitoral hood. Breathing and heart rate increase. And then in the orgasm phase, the sexual tension peaks. So here the clitoris remains retracted under the hood, the orgasmic platform contracts, contractions take place in the uterus along with rhythmic contractions in the vagina, and the rectal sphincter and anal sphincter also contract. These contractions are involuntary. And finally, in the resolution phase, the uterus lowers, the orgasmic platform disappears, the vagina returns to normal, and the clitoris returns to an unaroused position. In some women, this may not occur until after repeated orgasms. If semen has been ejaculated by a male partner, it will form a pool in the vagina near the cervix. Now let's turn to the male sexual response. Males and females follow roughly the same pattern of excitement and orgasm, with two exceptions. First, men become fully aroused in a shorter amount of time. And then second, once men experience ejaculation, they usually cannot do so again for some time. So females have more of a capacity to experience repeated orgasms. Now, in the same way as females, sexual arousal in men includes myotonia, which, as you remember, is an increase in muscle tension, and vasocongestion, or engorgement of the tissues with the blood. So vasocongestion is most apparent in the erection. So what exactly happens during an erection? During erection, the blood vessels expand, which increases the volume of blood. This is especially evident in the corpora cavernosa, which fills with blood, while veins that normally carry blood out and away from the penis are compressed. Before ejaculation, the Cowper's glands secretions appear at the tip of the penis. The length of time an erection lasts varies greatly. Now, the failure to attain an erection is experienced by most people with a penis at one time or another. Failure to have a firm erection can be related to health conditions like diabetes, stress, depression, or blood pressure. It can also be related to some medications, including some blood pressure medications and some antidepressants. After erection and with stimulation, ejaculation occurs in two stages. The first is emission, in which rhythmic contractions occur that send sperm into the vas deferens and urethra. This is accompanied by the sensation of ejaculatory inevitability. This is accompanied by increased heart rate and higher blood pressure. Now, in the second stage, expulsion, there is a rapid rhythmic contractions that cause semen to spurt from the urethral opening. These contractions are quick at first and become less intense and lengthen. So it's important to know that even though we put a lot of effort into trying to find sex differences between genders, there doesn't seem to be a significant biological difference in how males and females experience orgasm. In fact, there are more detectable differences in how people from different cultures experience orgasm than differences between sexes within a culture. Now, orgasm usually accompanies ejaculation. Orgasm is the intense, pleasurable physical sensation and general release of tension that typically accompanies ejaculation. Very objectively, orgasm is a series of muscular contractions of the pelvis that occur at the height of sexual arousal. However, it's possible to ejaculate without an orgasm and to orgasm without ejaculation. After ejaculation occurs, males usually go through what's called a refractory period. This is a period where men are not capable of having an ejaculation again. Now, this can last from a few minutes to a few hours. Persons with male genitals can strengthen the muscles that surround the penis to produce more intense orgasms and ejaculations. These are sometimes called Kegel exercises. All right, so let's put it all together. In this slide, you see Masters and Johnson stages of male sexual response. These are the first two stages. In stage one, excitement, the skin of the scrotum tenses, thickens, and elevates. The testes elevate toward the perineum, and with vasocongestion, the penis moves from an unstimulated state to a partial erection and then to a full erection. In stage 2, late excitement or plateau, the prostate enlarges, the Cowper's gland activates, the scrotum thickens and tenses, the testes increase in size and are fully elevated, the color of the penile glands deepens, and secretions from the Cowper's gland appear at the tip of the penis. Okay, so then on this side, you see the final two stages of the male sexual response. In stage three called orgasm, the vas deferens contracts, the internal sphincter of the bladder contracts, the seminal vesicles contract, the prostate gland contracts, and the rectal sphincter contracts. Penile contractions take place, and sperm is expelled by rhythmic contractions out of the urethra. And then finally, in stage 4, resolution, the erection subsides and the penis returns to an unstimulated state. Testicular congestion subsides, the testes descend, and the scrotum thins, and folds return. All right, so we've talked now about the female and male sexual response. Let's move on to talk about sexual attractiveness. Sexual attractiveness is not universal, since what is considered attractive varies by person and by culture. But there appears to be just a couple of traits that people consider to be important with respect to sexual attractiveness, which are youthfulness and good health. So when you ask persons in different cultures what features they consider attractive, these two features seem to be endorsed across cultures. Youthfulness and health can be indicated by having good muscle tone or smooth skin and clear eyes. So why might this be the case? One potential lens to see this through is an evolutionary lens. The idea is that animals, including us, want to reproduce their own genes, and therefore we want to reproduce strategies for choosing mates that can provide us with the best possible chance of having healthy offspring. From this perspective, sociobiologists have theorized that when we choose mates who appear youthful and healthy to enable healthy reproduction. But it's important to keep in mind that this theory cannot be tested, so it really remains just a theory. And importantly, from culture to culture, there is considerable variation in what parts of the body are considered erotic and what constitutes attractiveness. So in the US culture, large breasts among women and large biceps among men are considered attractive, whereas these are not markers for attractiveness in other cultures. But what does seem to stay consistent is that across cultures, symmetry in features is seen as attractive. So eyes that are symmetrical and arms that are the same length, for example. Finally, scent is another feature that could drive attractiveness for some people. And interestingly, people who are judged to have a sexy smell are more likely to have symmetrical features compared to those whose scent is judged as less sexy. Sexual desire is a psychobiological component that motivates sexual behavior. It's affected by physical, emotional, and sexual relationship issues. Now, the study of such desire has not been as robust as other areas of human sexuality because desire is really difficult to define. Importantly, emotional closeness appears to be a driver of sexual desire. So, researcher Sherry Blumenstock examined young adults' expectations of orgasm, non-orgasmic sexual pleasure, and emotional closeness during sex, and their casual role in sexual desire. The results of this study revealed that sexual desire was most strongly influenced by expectations of emotional closeness. Another finding was that both emotional closeness and non-orgasmic pleasure expectation, again, expecting those things, has stronger impacts on women's desire than on men's desire. The research that's available also shows that men express higher levels of sexual desire than women, in general. Of course, you can't predict that for each individual. For example, a study using the Sexual Desire Inventory 2, this was in 1996, showed higher levels of desire among men compared to women, although the highest levels were among middle-aged participants of both sexes. However, desire can vary substantially over time. A Finnish study by Harris in 2023 tested the lay assumption that women's sexual desire varies substantially over a period of time and men's sexual desire is more stable. The results showed a short-term pattern of sexual desire similar for both men and women, yet some findings indicated that women showed greater variability in sexual desire over the long term. Two factors that impact sexual desire are the degree to which someone is erotophilic or erotophobic. Let's define those. So, erotophilia refers to a positive emotional response to sexuality, whereas erotophobia refers to a negative emotional response to sexuality. Erotophilic persons accept and enjoy their sexuality, tend to experience less guilt about having sex, enjoy talking about sex, report being less homophobic, and seek sex out more often than persons who are erotophobic. These traits are not fixed. So a person can sort of, through positive experiences, alter their erotophobic responses over time, should they want to. All right. So let's move on to our next topic. So whether we have a positive or negative view on sexuality in part rests on what sexual scripts we've developed. So recall that sexual scripts are roadmaps for how we organize and direct our sexual behavior. And these scripts in our culture are highly gendered, as we talked about in chapter 5. These scripts strongly influence our sexuality as men and women. Sexual scripts have several distinct components. There is a cultural component that provides the general pattern of sexual behaviors that we're expected to take. So this component prioritizes, for example, heterosexuality, tells us that sexual intercourse is more important than other types of sex, and discourages masturbation. So that's sort of the general, broad social component of our sexual scripts. But while culture provides a general idea about what is accepted in our society, there's a huge amount of individual variation that often conflicts with these sort of broad cultural scripts. So that's why we also have an intrapersonal component, which deals with the internal and physiological states that lead to, accompany, or identify sexual arousal. So these are our individual thoughts and feelings that we have about sex and sexuality. Now, in addition to an intrapersonal component, there's also an interpersonal component that involves shared conventions as signals that enable sexual behaviors between two people. So, as you know, we all have interpersonal scripts for how attraction leads to sex and how that sort of unfolds between people. And this can sort of change and develop as we age. Now, some sexual scripts among college-age women and men include: men have a strong physical orientation towards sex, while women have a strong emotional orientation towards sex. Men initiate sexual encounters, while women act as the gatekeepers for sex. And men are expected to be sexually skilled and knowledgeable, as well as be ready for sex. So again, those are sort of the sort of classic cultural or societal level sexual scripts, but there can be a great deal of variability from individual to individual. All right, let's turn to sexual practices. So the first sexual practice we'll talk about is autoeroticism. Autoeroticism are sexual activities that involve only the self. So autoerotic behaviors are inherently intrapersonal rather than interpersonal, since it's only one person. That is, they involve one's own sexual fantasies, erotic dreams, viewing sexually explicit materials by oneself, using vibrators and other sex toys by oneself, and masturbation. And what's interesting is that people who engage in more autoerotic behaviors are also more likely to have a partner, more likely to engage in oral and anal sex with their partner, more likely to have frequent sex, and maybe more likely to have elaborate sexual scripts. Autoeroticism relies heavily on sexual fantasies and dreams. Sexual fantasies are defined as any mental imagery that is sexually arousing or erotic to the individual. And studies show that about 95% of women and men, so of pretty much most people, report having sexual fantasies. So this suggests that men and women think about sex often and experience numerous different fantasies. However, more men than women report thinking about sex at least once a day. Erotic fantasy is probably the most universal of all sexual activities. These fantasies are part of the body's regular, healthy functioning. And studies show that the higher the sexual drive, the higher the frequency of sexual fantasies and level of satisfaction in one's sex life. Common types of sexual fantasies include group sex, bondage sex, having new sexual experiences, taboo or forbidden sex, non monogamy, experiencing passion and emotional fulfillment, and exploring gender and sexual orientation in fantasies. So, what is the role of sexual fantasies? Why do we have them? There are a few different functions. They help direct and define our erotic goals. We fantasize about them, and that directs our sexual behavior. They also allow us to plan and anticipate different situations that can arise. In other words, they allow us to sort of mentally rehearse sexual situations. They may provide escape from a dull or oppressive environment. And let's face it, life can be pretty dull sometimes, so it's a good escape from that. Even when our sex lives are satisfactory, they bring novelty and excitement into a relationship. In light dreams, they may offer clues as to our current interests, pleasures, anxieties, fears, or problems. So fantasies can sort of act as a sort of window into our lives. So is it okay to fantasize during sex? Rest assured that many people fantasize during sex. Many people, sometimes men more than women, report having fantasies about someone other than a current partner. Almost all men and 80% of women report having sexual fantasies about someone other than their partner. These fantasies are usually a continuation of daydreams or masturbatory fantasies. Sex therapists consider fantasies about others to be a normal part of the human sexual experience. And what about erotic dreams? Well, once again, sexual images in dreams are common and sometimes intense. Sometimes overtly sexual dreams are experienced as exciting, and sometimes they aren't. Likewise, sometimes dreams that don't appear to be particularly sexual can cause arousal, physiological arousal, such as an erection. And nocturnal orgasm, commonly known as a wet dream, these are almost always accompanied by dreams. And interestingly, women seem to feel less guilty or fearful about nocturnal orgasms than men. Women are more likely to accept them as pleasurable events. All right, so let's dive more into the topic of masturbation. People masturbate for a lot of reasons. This can include relaxation, relief of sexual tension, physical pleasure, or to aid or an aid to falling asleep. They may masturbate if their partner is not available or doesn't really want sex, or they may do it as a means of avoiding STIs or unintended pregnancies. Again, this is just a short list. There are certainly other reasons why people might masturbate. Masturbation is an important means of learning about our bodies, and there are no known harmful physical effects of masturbating. So most young people receive very little positive information about masturbation and must come to terms later with a dual stigma and pleasure cultural message. Now, studies show masturbation is a common behavior that can be considered a typical and pleasurable part of an individual's and couple's sexuality. So it is either practiced alone or in a partner relationship, and it's common among all ages, sexual orientations, and ethnicities. One study found that college-age men masturbated an average of 36 times in the past 3 months, while college-age women did so 14 times. And engaging in masturbation is influenced by education, ethnicity, religion, and age. Education appears to be particularly a strong factor, with studies showing that more educated people more frequently engage in masturbation. So, what's the course of masturbation through adulthood? Masturbation is common among youth, peaks in young adulthood, and tends to decrease in later years. Women who masturbate appear to hold more positive sexual attitudes and are more likely to be orgasmic. Studies show that no two women masturbate in exactly the same way, but most involve some type of clitoral stimulation. Now, among men, nearly all methods of masturbation involve some type of direct stimulation of the penis with the hand. Importantly, most people continue to masturbate after they marry or are in a steady relationship. There are many reasons someone might continue to masturbate after they enter a relationship, including that they find it pleasurable, or they may do it when their partner is away, or they may or as a way to get erotic stimulation during times of relationship conflict. Now, these are just, again, a few reasons. There might be a host of other reasons people might continue to do that. So here you see the percentage of Americans aged 14 to 70 years old who report masturbating and that's divided by men and women in this graph. So a higher percentage of men at all ages report doing so than women, and masturbation across both men and women peaks at ages 25 through 29. Now, for a more detailed look at what sexual activities U.S. adults engage in across age groups, check out Table 5 in the book. This shows sexual activities ranging from oral, vaginal, and anal sex to role play to BDSM. All right, now that we talked about masturbation in detail, let's turn to sex with others. Oftentimes, when we think about sex, we exclusively think about sexual intercourse, and specifically, we think about vaginal intercourse. However, sex is not limited to sexual intercourse. Individuals engaging in a variety of sexual activities, and those can include erotic touching, kissing, and also, of course, oral and anal sex. The National Survey of Sexual Health and Behaviors, or NSSHB, assessed the contextual factors during the last single event of couple or partner sex among 4,000, almost 4,000 US adults. So, a few important findings were that most participants reported that their most recent sexual event occurred in their own or their partner's home. The majority of the most recent sexual events occurred within a relationship or with a dating partner. Although, importantly, among 18 to 24-year-olds, the majority of those sexual encounters were with dating partners or casual sex partners. Most persons reported other sex partners, and penile vaginal intercourse was the most commonly reported behavior. Again, this is just behavior overall. Within those data, there'll be a lot of variation by individual about what they engage in. So, American culture has become more sexualized and open to sex than ever before. There really has been a shift in the acceptance of things like non-marital sex and the use of dating apps to find sexual or romantic partners. Researcher Jing Twenge and colleagues analyzed data from the nationally representative General Social Survey, and they found a few interesting things. First, American adults had, on average, sex 53 times a year in 2014, as compared to 62 times a year a quarter century ago. So sexual frequency appeared to also decrease among partnered persons, so those who were married or living with a partner, but sex frequency stayed consistent among those who were not partnered. And interestingly, sex frequency was highest among the generation born in the 1930s, while in fact millennials reported the least amount of sex and the fewest number of sex partners. So again, it sort of shows a general trend of a decrease in sexual frequency across generations. All right, so in addition to sort of having sex less often, what are some other important findings? Well, there is certainly less research on same-sex sexual behaviors, but in this graph, here you see the frequency of engaging in sex more than 2 times per week by 4 types of relationships. So females in same-sex relationships, in other words, lesbians, females in mixed sex relationships, males in same-sex relationships, so gay men, and then males in mixed sex relationships. So there's some important findings just to kind of point out. First, in terms of never engaging in sex more than 2 times per week or hardly ever, the highest rates of those were among females who were in same-sex relationships. However, when we get to sort of the other end of it, sort of usually having these or always having sex 2 or more times per week, then we see that couples that are in mixed sex relationships, either females or males, tend to be having some of the highest levels, and then that was followed by males in same-sex relationships. So again, we do see some variations in terms of frequency of sex by different types of sexual partnering. Okay, so here you see the duration of average sexual encounter by the same relationship pairings we saw in the last graph. So female same sex, female mixed sex, male same sex, and male mixed sex. And the different duration categories are less than 10 minutes, 10 to 15 minutes, 15 to 30 minutes, 30 to 45 minutes, 40 to 60 minutes, 1 to 2 hours, and more than 2 hours. So just some things to note. It looks like the highest percentages of all of the groups are in terms of how long sex is lasting is somewhere between 15 and 45 minutes. But there's some variation in that. So when you look at 15 to 30 minutes, then males in mixed sex relationships are reporting the highest percentage of them are reporting 15 to 30 minutes. But when you look at 30 to 45 minutes, that's the highest percentage is being reported by female same-sex persons. And so again, overall, there's not huge differences between groups, but sort of notable when you break it down by average duration. So now let's go through some different types of sexual behaviors with others, beginning with touching. Touching is both a sign of caring and a signal for arousal. It doesn't need to be directed solely toward the genitals or erogenous zones, since the entire body is responsive to touch. Now, a problem can occur when people in a relationship interpret touch differently. For example, if one person interprets touch as intimacy, while the other only interprets touch as a prelude to sexual intercourse. In this case, there can be a conflict since the person who interprets touch as a prelude to sexual intercourse might feel pressured to have sex when that may in fact not be intended. So, in couples who are experiencing a loss of desire or maybe a conflict between what people are expecting from touch, Masters and Johnson defined a type of touching called pleasuring, and this is non-genital touching and caressing. In pleasuring, one partner guides the other partner's hand over their body and lets the partner know what feels good. So, pleasuring can open the door of communication between partners and is often a step in reestablishing desire between couples. But some types of touch are explicitly sexual. Tribadism is the pressing together of bodies with genital thrusting. Sometimes this is referred to as dry humping, or among female same-sex partners, scissoring. In a similar manner, interfemoral intercourse is rubbing the penis between the thighs of a partner, which may be used for stimulation or for avoiding STIs or unwanted pregnancies. Now, in many of these situations, stimulating a partner's clitoris or penis with a hand or fingers can increase excitement and lead to orgasm. However, direct stimulation of the clitoral gland can be painful during certain states of arousal, so stimulating on either side of the clitoris may be preferred. All right, next we'll talk about kissing. Kissing is usually our earliest interpersonal sexual experience and is probably the most acceptable of all sexual activities. Kissing is regarded by both men and women as a romantic expression. Indeed, couples who report the most frequent kissing also report the highest relationship satisfaction. It can also be erotic since the lips and the mouth are highly sensitive. And during kissing, the senses of taste and smell are also engaged. Romantic kissing or lip-to-lip contact is not the norm in most world cultures, and some even consider it repulsive. It's most common in the Middle East, but practically non-existent in Central America. All right, next up is oral sex. So oral genital sex includes cunnilingus and fellatio. Oral sex is an increasingly important aspect of the sexual lives of high school and college students of every sexual orientation. Cunnilingus is the erotic stimulation of a woman's vulva and or clitoris by her partner's mouth and tongue. In contrast, fellatio is the oral stimulation of a man's penis by his partner's sucking and licking. In contrast, autofellatio is a person with a penis stimulating his own penis orally. Okay, and so now we're to sexual intercourse. So this is another scientific name for vaginal intercourse, penile vaginal intercourse, and penile anal sex. Sexual intercourse is also called coitus. And of course, as we know, the prevalence of sexual intercourse is quite high. Sexual intercourse often has intense personal meaning as a source of pleasure, communication, connection, and love. However, if forced, it unfortunately becomes an instrument of aggression and pain. Now, and sexual intercourse has a lot of significance in our culture. For example, among some people, sex equals intercourse, at least in their own thoughts. And its occurrence is the pass fail performance test. In other words, they think if sexual intercourse didn't happen, then they didn't really have sex. Of course, this is erroneous. Sexual intercourse can also occur among female-female partners and can include sex toys and other devices that can be used for vaginal penetration. The book provides many examples of sexual positions, so be sure to read the chapter for a lot more information. The most common position is face to face with a male on top. This can occur in many types of partnerships, from heterosexual to gay male partnerships to partners that include transgender women and their partners. Also common is face to face with a female on top. This position allows the female more control, and the position tends to be less stimulating for the insertive partner, that is, the partner with a penis, and thus making it easier to control ejaculation. There are many other types of positions, such as rear entry position, face-to-face side position, and wheelchair sex. And the power of sexual positions has been described for centuries. For example, tantric sex is based on Eastern religious beliefs and involves the couple sharing their energies by initially thrusting minimally and harmonizing their breathing. Sexual intercourse is not just penile-vaginal intercourse. Anal eroticism is sexual activities involving the anus. Now, the delicate membranes in the anus make it erotically arousing for many people. And there are a number of ways to stimulate the anus. This can include analingus, which is the licking of the anal region. It also might be stimulated by anal manual contact that involves the insertion of fingers or the fist. And anal penetration is the insertion of an erect penis or other device, such as a sex toy, into the partner's anus. And anal intercourse, of course, is participated in by people of all genders and sexual orientations. But as we'll talk about more in later presentations, because the rectum is particularly susceptible to STIs, anal sex is riskier than most other forms of sexual interaction with respect to sexually transmitted infections. All right, even though many people don't really think about cleaning up after sex, there are some things that one should do to protect themselves and their partners from things like urinary tract infections and STIs. People should consider washing around their genitals, but not inside the vagina, with plain warm water or mild soap. And most doctors recommend that women do not douche. Males should pull their foreskin back and wash underneath, particularly if they aren't circumcised. All right, so we covered a lot of ground in today's presentation. To end, there are numerous health benefits of sex. When sex is fun, it brings unique joy and satisfaction. And studies show that persons who frequently engage in sexual activity also report numerous health benefits. Beverly Whipple, who is sort of a very famous sexologist, noted that it is not entirely clear whether sex makes people healthier or whether healthy people tend to have more sex. Either way, it tends to be a good thing. That is to say, good sex and good health reinforce each other. And that concludes this lecture.